resulting from the COVID-19 vaccine as they would for other vaccines. Dr. Bardosh, do you think this lack of recourse has implications for public health more broadly?
First of all, that sounds like a very tragic story. And those stories are not unique to one individual, unfortunately. I think it's hard for the public health community to acknowledge side effects like that, but they really need to. And it's clear that the vaccine injury system in the country is broken, not only in this country, but also in Canada and elsewhere that I'm familiar with. Yeah, it's obviously something that's very alarming, and there needs to be a concerted effort. I'm not sure what the process can be, but to reevaluate these injury court systems. Because I've had people reach out to me who also have been injured, and they've said, look, I've been dragged through the mud in the bureaucratic red tape. And even I have confirmation from my doctors that actually there is a causative link here, which does happen, right? And yeah, there's sort of an inhumanity to the bureaucracy that I think really needs to be looked at.
Thank you. And for those that are listening, the CICP is the government's countermeasures injury compensation program that is supposed to compensate people for adverse effects from COVID-19 vaccine. And that's what he has tried to get for over 18 months and has not even gotten an answer. Dr. Bardosh, in your May 2022 paper, you wrote, our analysis strongly suggests that mandatory COVID-19 vaccine policies have had damaging effects on public trust, vaccine confidence, political polarization, human rights, inequities, and social well-being. Do you know if people in countries that have properly acknowledged and been compensated for their vaccine injuries have less overall vaccine hesitancy and more trust in their public officials?
That's a really good question. I would need some time to really be able to answer that because I have not looked at the data in sufficient detail. But I mean, my intuitive response is yes. Certainly if you look at, for example, the Nordic countries, Sweden, Denmark, et cetera, they had a narcolepsy problem with their H1N1 vaccine back in 2009. And they overhauled their vaccine safety system to build trust. And as far as I'm aware, their vaccination rate is higher than the United States for COVID. So I think acknowledging these safety signals does build trust. And actually, a study comes to mind where they actually looked at this issue, right? So the problem is, if you acknowledge a safety signal, it does decrease trust because people say, oh my goodness, this vaccine is not safe. But over the long term, it builds trust. And so what we're doing here right now on what we've done with mandates, in my opinion, is we've sacrificed long-term trust for short-term gain. And I just think that was a bad decision.
Thank you, and my time has expired, and I yield back.
Now recognize Ms. Takuda from Hawaii for 5 minutes of questions.
Thank you, Mr. Chairman. I'd like to focus my time on the benefit of our nation's COVID-19 vaccines and policies in protecting our national security and enhancing our military readiness. My Republican colleagues have suggested that vaccine requirements undermined military preparedness, but in fact, the opposite is true. Increasing vaccination rates in the military, including through vaccination requirements, helped to ensure that our service members were better protected against the spread and harm of COVID-19. These policies worked. In combination with other policies, vaccine requirements resulted in a 96% vaccination rate amongst service members. And most importantly, thanks to these policies, we have not lost a single service member to COVID-19 since November 2022. In the early days of the COVID pandemic, outbreaks of this highly transmissible virus threatened our nation's service members and their ability to carry out missions of critical importance to our national security and ensure our readiness to respond to threats. The USS Theodore Roosevelt, for example, experienced an outbreak in the early days of the pandemic that caused nearly 20% of crew members to become infected and resulted in the crew's evacuation to Guam for 2 months. An aircraft carrier out of commission for 2 months is not military readiness. Around the same time, an outbreak aboard the USS Kidd, a Navy destroyer, caused its crew to abandon their counter-narcotic operations in the East Pacific, forcing the vessel to turn back to San Diego so that crew members could receive medical care. Again, failure to complete a mission is not readiness. Without life-saving COVID-19 vaccines, requirements, and other mitigation strategies, outbreaks such as these could have been far more commonplace and dangerous, a threat to both the health of our service members and national security, disrupting military operations, undercutting our nation's ability to maintain a strong and ready military force. Dr. Lynch, yes or no, would we have likely seen more of these mass infections like those on the USS Theodore Roosevelt and the USS Kidd had we not required vaccination amongst our service members? Yes. Thank you. Another yes or no question. It has been alleged that recruits were hesitant to join our military due to vaccine requirements. Do you think that the extensive misinformation campaign that undermined confidence in the COVID-19 vaccination contributed to this likely and alleged hesitancy? Yes or no? Dr. Lynch, from your perspective as an infectious disease expert, was COVID-19 vaccine requirements essential to ensure national security and military readiness by preventing dangerous outbreaks from occurring like the ones we saw on the USS Theodore Roosevelt and the USS Kidd?
Yes.
Thank you, Dr. Lynch. I'd like to elaborate a bit more on the historical context brought up by the gentlelady from North Carolina at this time. For hundreds of years, our military has recognized the importance of immunization to military readiness, dating all the way back to the Revolutionary War. Smallpox ravaged the Continental Army during the early days of the war, including the failed invasion of Quebec. Members of the Continental Congress, including John Adams, identified smallpox as the cause of that defeat. Widespread fear of smallpox in the ranks also deterred new recruits from joining the Continental Army. Recognizing the threat smallpox posed, George Washington ordered smallpox inoculations among the Continental Army in 1777. He acknowledged that this order may pose some inconveniences, but that it would ensure troops were prepared for combat, and it did. Soldiers' reported illness rates were cut by nearly 2/3, which helped inspire a fresh wave of new recruits to join. Later that year, the Continental Army scored a decisive victory at the Battle of Saratoga, and another wave of inoculations at Valley Forge that winter helped ensure the Army was ready for future campaigns. Washington's decision to require inoculations helped win our nation's independence. Today, we have a multitude of vaccines that safely and effectively prevent illness and keep our troops ready for combat. As of 2020, mandatory vaccinations for our military personnel include hepatitis B, MMR, Tdap, polio, meningococcal, and influenza. This is nothing new. Yet my Republican colleagues would like the American people to believe that recruitment and retention issues in our military are a result of COVID-19 vaccine requirements. We know, whether it's DEI initiatives, access to reproductive care, critical race theory, or other DoD policies, my Republican colleagues continue to bring culture wars and misinformation campaigns into our military. But the evidence could not be clearer. COVID-19 vaccines are safe, they're effective, and significantly reduce the spread of the virus. They save lives. The truth is that if Republican leaders who politicized COVID-19 vaccine requirements helped drive recruitment and retention issues, they undermined the operational readiness of our military, they hurt our national security. My time is up, Mr. Chair, and I yield back.
I now recognize Dr. Joyce from Pennsylvania for 5 minutes.
Thank you, Chairman Wenstrup, for holding today's hearing. And thank you for the witnesses. Thank you for offering your time, your expertise, and your testimony before this committee. Today's hearing, entitled "Because I Said So," examining the science and impact of COVID-19 vaccine mandates, could not be any more fitting, especially since it was the government who demanded that individuals get the vaccine or else. Even worse, it wasn't an empty threat. People lost their jobs, our children's education and growth was stifled, and our military and healthcare workers were terminated simply because they refused a government-mandated vaccination. That's what we're examining, that's what we're talking about today, the mandate component of it. There is a line between providing information, recommendations, and administering vaccinations to those who choose so. And the other side of the line is a forcible and coercive blanket mandate that the federal government imposed during a pandemic that many Americans were forced into losing their jobs. This committee has continued to expose the flaws and neglect that took place during the pandemic. It has been our responsibility to ask the difficult questions, questions that deserve answers. It's clear that the American people's trust in public officials has been harmed by failed policies and flawed mandates. Dr. Bardas, In your paper, you mentioned that political leaders singled out the unvaccinated and blamed them for the continuation of the pandemic. In fact, in July 2021, during the onset of the Delta variant wave, CDC Director Rochelle Walensky said that it was, and I'm quoting, becoming a pandemic of the unvaccinated. Is this the sort of blame, Dr. Bardish, that you were referring to in your paper?
Yes, it's a scapegoating response.
Dr. Bardish, I'm going to make this simpler. Do you believe that this sort of language is harmful when we look for public officials in charge to scapegoat?
I think, the HIV/AIDS community has done a lot of research on stigma and scapegoating, right? And, decades of research has shown that stigma as a public health strategy is counterproductive. I'll leave it at that.
Dr. Bardish, let's amplify some of the points from your publications. There was a collaborative effort that you published with researchers and physicians from Johns Hopkins, Harvard, and Oxford. Yes or no?
Yes.
Did the COVID vaccine mandates from your research, from your publication with others, erode civil liberties?
Yes, it did.
Fracture trust in public health officials?
Yes, it did.
Did the COVID vaccine mandates create financial stress to individuals and families who lost their jobs to the COVID mandates?
Absolutely.
And Dr. Bardish, do you feel that the decrease in individuals receiving routine pediatric immunizations for their children, do you feel that is due to the mandates of the COVID vaccine?
Yes, I do.
And finally, and I thank you for your brevity, Dr. Bardish, do you feel that the COVID-19 vaccine mandates have harmed America?
Yes, I do.
I think the message that you conveyed to this committee is important. We have looked and discussed origins, we have looked and discussed impact, and that is what the obligation of this select subcommittee is. It is our obligation to understand the COVID-19 vaccine, its effect on mandates. I thank each and every one of you for your testimony today, and Chairman Wenstrup, I yield back.
Thank you. I now recognize the ranking member of the full committee, Mr. Raskin from Maryland, for 5 minutes.
Mr. Chairman, thank you very kindly for the time. I confess arriving late, which is perhaps the explanation. I'm a bit puzzled about what's going on here because the COVID-19 cost us nearly 1.5 million people in the country. It was calamitous to the public health and a terrible shock to the economy and the society. President Biden's vaccine program, according to the Commonwealth Fund, saved 3 million lives and 18 million hospitalizations for serious effects from COVID-19. And so I'm just surprised that the tenor of this hearing is to attack I think the very selective cases in which there were vaccine mandates, for example, for public health workers, for people in the military, and a handful of other populations like that. I suppose the first question is it constitutional? And I think my colleague from North Carolina dealt with that. I mean, if you just go to the website for your local school system and look and see what shots your kids have to get before you enroll them in kindergarten or 7th grade or 3rd grade. I just looked at ours, tetanus, diphtheria, tetanus, pertussis, measles, mumps, rubella, chickenpox, polio. Is anybody making the claim? I'm happy to yield for 3 or 4 seconds. Is anybody making the claim that these are unconstitutional? Okay, because none of them have ever been struck down on constitutional grounds. So we're not talking about a violation of due process liberty or even what's left of it after the Supreme Court's decision striking down Roe versus Wade and Planned Parenthood versus Casey. I mean, that, of course, was a catastrophe for the idea of due process, privacy, and liberty interests against government mandates. But I've not heard an argument that it's unconstitutional. Is it good for the public health? It's hard to see how it couldn't be good for the public health, for example, to have public health workers vaccinated, or people in the armed forces who already have to get all of these other shots also to get another shot for COVID-19. So my last colleague asked the question, well, did the COVID-19 mandates, and I'm surely the image of mandates went way beyond what the reality of the mandates were, given that they were geared to very specific subsets of the population. But I think a bigger question is, did all of the anti-COVID-19 propaganda undermine people's faith in public health authorities? I mean, when Donald Trump urged everybody to get hydroxychloroquine, or floated the idea of just injecting yourself with bleach, or just said that magically COVID-19 was going to disappear overnight, or saying, don't worry, you know, the Chinese government is doing a great job, they're doing a magnificent job, and on 36 different occasions praising the work of the Chinese government. You can check it out online, sir. And I'd be very happy to send you all of the tweets and the statements that President Trump made praising President Xi and his magnificent work on COVID-19. I think that probably had a lot more to do with undermining people's confidence in public health. But Dr. Lynch, let me ask you, do people have a free exercise religious right not to follow a vaccine mandate, you know, as a public health worker in the military, for example, or any secular law that they think burdens their religious freedom?
I'm not a legal scholar, but I can speak to the process, and that is that when I look at this in our own system and people would submit religious requests for accommodation, there was no question as to sincerely held religious beliefs, and I think that's a common approach. The question is really, can I make you as safe as someone who is vaccinated? And the answer in healthcare settings, and I think in many other settings, is no.
And I think it's an excellent way of thinking about it, because the Supreme Court, Justice Scalia, in the lead, has consistently rejected the idea that you have a free exercise right to opt out of, for example, marijuana laws if you're Rastafarian, or peyote laws if you're Native American Indian and part of that religion. Your religious free exercise rights don't give you the right to opt out of a generally applicable universal secular law that's not adopted for the purposes of religious coercion or intimidation. But we've made a voluntary accommodation for people, saying if you really don't want to do this in the school context in a number of states, then you don't have to do it. But of course, we see major outbreaks of diseases among the Amish, for example, or Orthodox Jews in New York and certain populations when they refuse to engage in certain vaccines. So I think that we're in the right place here, which is we invest in the vaccines, we get out real education against all of the propaganda as much as we can, and then we give people a voluntary right to opt out where we think we can afford to do that, and they benefit from everybody else's herd immunity, as we hope all of us will. I yield back to you, Mr. Chairman. Thank you kindly.
Now recognize Ms. Green from Georgia for 5 minutes of questions.
Thank you, Mr. Chairman. As we're talking about mandates today, I would like to read an email from one of my constituents, and this is what vaccine mandates said to her. Hello, I'm a retired RN who was forced to choose between being fired or receive mandated vaccination. I was too young to retire, so I had to be vaccinated. Shortly afterward, I developed stroke-like symptoms and was rushed to the hospital. Testing showed no stroke. I have been hospitalized 7 times since and no stroke on testing. I went to the Mayo Clinic in Florida and met with the top-notch neurologist there. He spent 2 hours with me, and during the visit, he asked which vaccine I received. When I told him the Pfizer vaccine, he was not surprised by my symptoms. I went from being a charge nurse running the floor, being on a code team, to a person who cannot remember how to take a shower, who walks like a drunkard and slurs her words. I cannot remember people from church or how to get to the grocery store around the corner from me. This has taken such a toll on my family as well. I caught my husband of 34 years crying because he misses me, the me I once was. I cannot stay focused and tend to ramble off subject and then cannot remember what topic was being talked about. I've applied for disability and have to wait at least a year till I might receive it. I feel so useless but I have the love and support of my family and friends. There are so many more people like me out there. I want you to be our voice, and today I will gladly be her voice. Let's talk about what mandates have done. This is the VAERS reporting system and how many deaths were reported to VAERS by year. The blue is all non-COVID vaccine deaths. The red is reports of death related to the COVID-19 vaccine. This is 2021, this is 2022. The total reports following COVID-19 vaccination by year. As you can see, the first year that the FDA gave the emergency use authorization, it was 10,596. It rapidly increased in 2021 to 700,194. 2022, 206,673. And what happened? Mandates went away during 2022 and are still being forced in some places, but are much less. But in 2023, the numbers are 44,680 so far. This was dramatic. In 2020, the same year that the FDA gave the emergency use authorization, COVID was the #2 highest reported vaccine injuries and deaths on VAERS. But easily it went to #1 in 2021 and obviously #1 in 2022. Let's talk about the things that have been reported. Characteristics on the reports. Death, 17,432. Permanent disability, 17,142. Hospitalization, 81,931. Emergency room and office visits, 310,040. Serious adverse events, 107,722. What else has happened? Let's compare the VAERS COVID and flu vaccine reported deaths by days to the onset of all ages. Days of onset, COVID vaccine rapidly reported that death happens immediately after the vaccine. Flu vaccine, much lower rate. If anyone's wondering why there's vaccine hesitancy, look no further than the VAERS reporting system, because many of these people's stories were taken off of social media and censored. These people were called conspiracy theorists when they talked about this happening to their family or their friends. Reports on menstrual and hemorrhages by year. If anyone wants to understand what this has done to women, and Ms. Williams, I have great sympathy for you being let go by ESPN for refusing a COVID vaccine, and you should have never been fired for that, but you were right. You were right to listen to your doctor. There's been serious reports of changes in women's menstrual cycle and hemorrhages. Here's 2020 again. That's the same year that emergency use was given for the COVID-19 vaccine. Reports of miscarriage. Ms. Williams, you were right again. Miscarriages increased drastically, but yet no one seems to want to listen to these women. It's shocking. Myocarditis and pericarditis reported. 2021 and 2022, hardly ever reported before vaccine mandates, COVID-19 vaccine mandates. Does anyone want to know why people don't want to join the military until the mandates were taken away? That's it right there. This is not a conspiracy theory. Let's talk about heart attacks reported within days of onset. Heart attacks, this is the highest amount right within the first day to the second day of receiving the COVID-19 vaccine. What did the Pfizer execs know? They did not test if the COVID-19 vaccine would prevent transmission before release. Mr. Chairman, I just need a little more time. Dr. Burke says she knew the COVID vaccine would not protect against infection, but yet mandates were forced. But what about people and their stories? Here's a comedian, Nick Nemiroff, dead at age 32. He said, "I will not get the third shot. I will not. Pfizer me once, no shame. Pfizer me twice, shame on COVID. Pfizer me 3 times, shame on you. You want me to get a third shot? What's next? A 5th? No, thank you." Then he died, age 32. What about all the athletes? This Shane Warne, get your double vax and get on with it and learn to live with it. Australian cricket legend Shane Warne dies in his sleep. What about the young kids? Teen equestrian star Sienna Knowles hospitalized with blood clots after Pfizer vaccine. The stories go on and on and on. But I'll leave you with this. From February 21 to March 2020, millennials experienced the equivalent of a Vietnam War. A Vietnam War. With more than 60,000 excess deaths, the Vietnam War took 12 years to kill the same number of healthy young people. We've just seen die in only 12 months. Mr. Chairman, I yield back. Thank you.
Now recognize Mr. Garcia from California for 5 minutes of questions.
Thank you. Well, that was a lot. I want to just first start by saying that we know that the VAERS system should not be used as an unverified way of actually looking at the numbers. And so to continue to bring that up as actually a functional way of looking at the impacts of the pandemic is quite irresponsible. And I think that the comments we just heard, I think, speak to a lot of the other comments that we've been hearing in these hearings, and that is that there is a complete dismantling of the importance of what vaccinations actually have done in this country and how many lives they've actually saved. The track record on the House Republican side as it relates to this issue and the pandemic has been quite shameful. We know that COVID vaccines have saved lives, period. Every reputable doctor, this has widely been a peer-reviewed, and we know that they have saved lives, and not just the COVID vaccine, it's other types of vaccines as well. And as we've said earlier, as it was mentioned by the ranking member, the House majority invited RFK, who, as we all know, is a conspiracy theorist and a vaccine denier, as a leading voice around issues around vaccines and the pandemic here to the House. We know that his opinions have already been discredited and they're dangerous, and yet he's somehow someone that is uplifted by the House majority on this issue. But beyond that, we know that RFK has made also racist and anti-Semitic statements, falsely claiming that COVID was deliberately engineered, and I quote, an ethnic bioweapon targeted to attack Caucasians and black people, and that Chinese and Jewish people are more immune to COVID. So these are the experts that the House majority continue to listen to, and was invited, of course, to appear to a House committee. Now, this isn't the first or most dangerous anti-Semitic trope that we have heard. In January 2022, he also said the vaccine requirements are worse than the persecution of Jews like Anne Frank during the Holocaust, which killed 9 million people, including 6 million Jews. And it shouldn't be surprising after this course, we have heard continuous anti-Semitic comments from the House majority. We have seen this tweet behind us before, and this person, of course, sits on this very committee, who just actually gave some very irresponsible facts to our witnesses and the committee as well. But just like RFK and other conspiracy theorists, members of this committee continue to attack vaccines. Vaccines save lives. The pandemic cost us 1.3+ million Americans. It's the single largest, most devastating loss of life event that we've had in the modern era.
Mr. Chairman.
It's the most significant
Yes.
loss of life we've had in the modern era.
I'd like-
Ms. Reed, please pause for a second.
I'd like to make a point of order and ask the members to be reminded of the rules of decorum, Mr. Chairman.
I'm sure, what rules are those?
The gentleman from California will suspend. The issues we are debating are important ones. Members feel deeply about them. You do. Everyone here does. Everyone. While vigorous disagreement is part of the legislative process, members are reminded that we must adhere to established standards of decorum in debate. It is a violation of House rules and the rules of this committee to engage in personalities regarding other members or to question the motives of a colleague. Remarks of that type are not permitted by the rules and are not in keeping with the best traditions of our committee. The chair will enforce these rules of decorum at all times and urges all members to be mindful of their remarks.
Mr. Chairman, what rule did I
Does
break?
the gentlelady from Georgia have any further? Anything? further
No.
comment?
Mr. Chairman,
The
I'm not
gentleman may proceed.
Thank you. I'm not sure what rule I broke. I actually didn't call anyone out by name and did not actually disparage anyone. I showed a actual tweet that one of the committee members actually tweeted. It's a public statement in the public record, so this is absolutely not disparaging anyone unless the committee member wants to retract what was said up here. We can read it if we'd like. It says a tweet. It says, vaccinated employees get a vaccination logo just like the Nazis forced Jewish people to wear a gold star. Vaccine passports and mask mandates create discrimination against unvaxxed people who trust their immune systems to a virus that is 99% survivable. So that's actually a public statement. I'm not sure that that is an attack on anyone. I mean, I disagree with it, but that's what was said. Let me go ahead and continue. We also know that studies have found that COVID death rates were 11% higher in states, and this is an important point, with Republican-controlled governments and 26% higher in areas where voters lean more conservative. In fact, of the 15 U.S. states with the highest age-adjusted death rates, 13 of them were led by Republican governors during the pandemic. And I say this because vaccine hesitancy actually and causing and pushing folks to not get vaccinated actually leads to higher death, and that is a fact. I want to talk about Ron DeSantis, the governor of Florida, who's running for president. He, of course, bragged early on about pushing against vaccine mandates, boasted about his record, but we also know that the latest medical journal just last month attributed over 16,000 needless deaths to his failure to get Floridians vaccinated. They also fell behind the national average throughout 2021 as Governor DeSantis increasingly caved to vaccine skepticism, and the constituents paid that price. According to a report in the New York Times, of the 23,000 Floridians who died, 9,000 were younger than 65, despite the governor's insistence at the time that our entire vulnerable population was basically vaccinated, and I end quote. I want to, Dr. Lynch, is it fair to say that vaccine requirements, along with robust public outreach and access to free vaccinations, result in actually higher vaccination rates?
Absolutely.
And in areas with higher vaccination rates, have we seen lower age-adjusted rates of hospitalization and death due to the pandemic?
Yes.
So it seems fair to conclude that these measures save some number of lives. Is that correct?
Correct.
And is it also true that discouraging vaccines and telling folks to not get vaccinated can actually lead to more death?
Yes.
Thank you. I yield back.
I now recognize Dr. Jackson from Texas for 5 minutes of questions.
Thank you, Mr. Chairman. Thank you to our witnesses for being here today. I want to start by saying that I'm not against vaccines, and I don't believe that the vast majority or any of my Republican colleagues are either, that I know of. I got the COVID-19 vaccine. Throughout this pandemic, I encouraged my family members, my friends, my constituents to speak with their doctor about whether the vaccine was right for them. However, I am 100% against unconstitutional vaccine mandates. As a physician, one of my most significant issues with the COVID-19 vaccine mandates was the interference with the pre-established patient-provider relationship. The Biden administration determined that they would implement a one-size-fits-all mandate and invalidate any decision between an individual and their doctor, the doctor who knows them and their medical history best. The bottom line is your vaccination status is between you and your doctor, and Washington, D.C. should have nothing to do with that. Various groups of Americans were negatively impacted by this one-size-fits-all vaccine mandate, and were forced to choose between their jobs, their religious beliefs, and their health and the vaccine. One of these groups was pregnant women and women trying to get pregnant. This was an expedited vaccine, initially being used under emergency use authorization, developed using new mRNA technology with essentially zero information on long-term effects. There were no studies, none, and no information available on potential risk to a developing fetus, and no information on fertility. Yet despite this, pregnant women and women trying to get pregnant were not provided an exemption to these totalitarian vaccine mandates. Many of these women were young and otherwise healthy with no significant risk from the virus. The CDC and the WHO, for political reasons and not scientific reasons, also disregarded this unique population and this lack of important data and pushed for pregnant women to get vaccinated. Even benign over-the-counter drug medications always say you should check with your doctor first if you are pregnant. We just heard one of our witnesses today, Ms. Williams, tell part of her story and how she had to make this difficult decision between her job, her concerns about her soon-to-be pregnancy, and taking the vaccine. Ms. Williams, you stated that you had a conversation with your doctor. Is that correct?
Yes, I did.
And you stated that he supported your decision to forego the vaccine. Is that also correct?
He did, yes.
I suspect that there were initially many such conversations. However, what I found to be true, I've talked to multiple physicians over the last few years. I just met with 30 or 40 of them that were addressing this very issue. I think that there were a lot of conversations that started like that very, very soon in the process, but very soon providers discovered that if they had these discussions and made these recommendations against the vaccine, that they were suddenly at risk of losing their jobs. Hospital CEOs, mostly non-physicians, came after doctors and nurses that didn't parrot the government's vaccine talking points, and state medical boards threatened to take licenses away, and national boards threatened to remove certifications. This is why it has eroded the doctor-patient relationship. This is why we have no trust in our public health sector anymore. And we are going to have to do everything we can to build this back. But I really am concerned that this is going to be an uphill climb. And it's rhetoric like we hear on the left and rhetoric like we heard on this other side of the aisle all day long that led to the distrust of the public health system and has now led to any vaccine hesitancy that happens to be out there. With that, Mr. Chairman, I yield back.
I now recognize Dr. McCormick from Georgia for 5 minutes of question.
Thank you, Mr. Chair. So I know all of you have expertise in different ways. I know Dr. Lynch, I've read through your resume. It's very impressive. You're an internal medicine physician. Obviously, you have a lot of experience in infectious disease. You're an instructor, a professor. And I'm sure you've seen patients during this pandemic. How many thousands of patients would you say you've seen for COVID during this pandemic?
I can't quantitate how many patients I've seen with COVID-19. I started working on the COVID-19 response in January of 2020 with the first diagnosed case in North America, and I've been working on it essentially full-time for the first 3 years on policies, protocols, as well as rotating on the infectious disease consult service.
But you've seen patients, right?
Starting February of 2020, yes.
Mm-hmm. And I too, I'm an ER doc that was campaigning during this, but also working full-time in the ER as a night shift doctor, seen thousands of patients. I did my medical school at Morehouse School of Medicine, student body president, and then was at Emory, a pretty good program for emergency medicine, taught by some of the finest professors, very similar to yourself, very well experienced. Would you say that I'm an expert after seeing thousands of patients and keeping up to date, reading articles after article and having the same kind of instruction? Would you say I too am an expert?
I have no doubt.
Based on what I just told you.
I have no doubt you have great expertise in emergency medicine.
Thank you. And probably in COVID too, as much as most people, right?
I can't speak to that.
So you can't speak to what I just said? I read your bio and I'm calling you an expert. Unless we can just play semantics and ignore what I just said, I'm telling you, I saw thousands of patients as an ER doctor. I was trained by Emory, a very good program, by instructors just like you, and you can't even admit that I'm an expert?
I'm sorry, I haven't reviewed your expertise.
So either you don't believe me or just, okay, that's fine. So let's just say that I am an expert, for argument's sake. There are experts out there besides yourself and other people who believe like you do, correct?
Yes.
Okay, thank you. What I'm trying to make a point here is I don't deny that you have your opinion or even that it could be right in certain people's minds, but I think just like in everything else, when there's a debate, the thing that drives me crazy about this whole COVID pandemic discussion is that people who have very good education, very good experiences, legitimate background in epidemiology, in infectious disease, in actually seeing patients, may have a difference of opinion. The problem is when the government decides who they believe and they start stacking the deck and they start censoring people that disagree with them, we have the real problem. And this is what I experienced as an expertise, whether I call myself that or anybody else recognize that or not. That's what I did for a living. I got paid to see COVID patients from the beginning of the pandemic all the way through December 28th of this last year. That's what I did for a living, and I read all the literature. Both sides, by the way. I try to be very well-rounded. What drives me crazy is the fact that if somebody disagrees with me, though, and they have a different opinion, is they could censor me. Now, I'm not an anti-vaxxer at all. I'm one of the first people in America to get the vaccination. 2 of them. But yet, it's funny that I watch my most liberal colleagues who wear 3 masks, double glove, and do all the other precautions that they take because they're scared to death of this disease, will not get the booster. And knowing what I know about this disease process and the fact that when you are exposed or you get a vaccination, you build immunity, and then you get re-exposed over and over again, I would say, and probably you would agree with me, there aren't too many people in this world, or at least in America that I know of, that haven't been exposed to this multiple times by now. Is that correct?
Yeah, it's hard to tell. There's probably a substantial portion of people who have, for reasons that are unclear, remain antibody negative, as you've probably seen in the paper published recently.
I have. As a matter of fact, I came back with a negative test. I think it's probably T-cell. I probably have a T-cell response that's not just picking up on the same kind of test for whatever reason. But I know I've been exposed to it thousands of times, both on the campaign trail and as an ER doctor. And so I must have some immunity because I haven't really gotten sick. Either that or I just don't react to it like a normal person does. But that's really inconsequential. I guess my point being that this whole debate over whether it be the military and young, healthy people or vaccination status and who's being immune, once people have been exposed multiple times, and they're either sick or not sick, but they have some sort of immunity, obviously, or they just don't react to the disease, and they're told they can't travel, they can't have a dissenting point of view, and they can't have a relationship with their doctor that decides their fate, we have a problem. This is what a lot of experts are saying, not just doctors, but people have had these experiences where if I don't do what you tell me to do, and what the government says is the moral standard of health care, which the government, by the way, in my honest opinion, this is everything anti-American I've ever seen, which is where we said the government gets to decide something more than anybody with an inalienable right to make their own decisions. This is the problem I have with the argument that people keep on saying that we're going to believe one expert over another expert and that we're not going to have any ability to actually make a conclusion other than what you come to if the government decides to take your opinion. And this is where we have the real problem. This is where we're having the real debate. It was interesting, well, you did say I was going to get a little extra just for seeing patients during COVID. No? Okay. Well, I thought that was the agreement, but let me just conclude with this then. I thought it was interesting that one of my colleagues mentioned John Adams and the experimental inoculation they're doing during that epidemic, if you will. And I know one of his daughters got very ill, if I'm not mistaken, almost died and had some permanent residual issues. And Abigail was one of my favorite first ladies, lamented over that and struggled over that, and that's okay. But she made a decision. We all make a decision. It's as American as putting your kids in the back of a wagon and going west where you may freeze, starve, or get killed, and that's why California exists right now. We make decisions all the time that are dangerous, but it's our decision. And the fact that we wouldn't let somebody travel or have a job or have an objection, I find is un-American. And with that, I yield.
Thank you, and thank you all. Dr. Bartish, I know you have to catch a flight. And so we're just going to go to closing statements. And so if you have to leave, feel free to leave. But I do appreciate you being here. I do appreciate your work. We will continue to follow your work because I think it's been very helpful, as is everyone's input today. But we won't take it as a sign of rudeness. If you need to go, please go. Thank you. I would now like to yield to Ranking Member Reeves for a closing statement.
Yeah, thank you, Mr. Chairman. Before we close out today's hearing, I just want to reiterate a few things again for the record and for the viewers. First, let me just say again that for those without contraindications, COVID-19 vaccines are safe. They're effective in reducing the risk of getting the virus or giving the virus to someone else, and it has reduced the risk of hospitalizations as well as death. And that is because of life-saving vaccines that we were able to save 3.2 million American lives, prevent 18.5 million people hospitalizations, save the country over $1 trillion in medical costs, reunite loved ones, reopen schools and businesses, and protect members of our nation's military. Second, I want to reiterate that vaccine requirements were temporarily put in place during the COVID-19 pandemic emergency declaration to combat a public health emergency when a dangerous, deadly virus was rapidly spreading and killing thousands of people a day. Despite my colleagues' claims, these policies weren't just made up by a bunch of politicians or arbitrary without science or history. No, they were well-reasoned policies that were crafted using the science of how vaccines work and have been known to work for over 100 years. When we look back on our nation's experiences battling highly transmissible, deadly diseases like smallpox, polio, measles, and mumps, we relied on high vaccination rates to protect people from severe illnesses and death. So when COVID-19 rolled around, a deadly, novel, highly transmissible airborne virus, we once again looked to a solution that we knew would offer the strongest protection at the lowest possible risk of severe illness, long COVID, death, transmission, which is vaccines. And finally, I want to reiterate that there is a strong legal foundation for vaccine requirements. Again, despite my colleagues' claims to the contrary, we know that these kinds of common sense requirements have been viewed as consistent with the First Amendment for over 100 years. Legal precedent tells us that neutral and general applicable laws do not violate the free exercise of religion under the First Amendment. And we know that COVID-19 policies, including vaccine requirements, have met this standard time and time again. So it is my hope that we can move forward in this select subcommittee to focus on solutions that will save people's lives in the next pandemic, solutions that ensuring people have access to the accurate data they need to make informed decisions about their health, and continuing to manufacture distrust in the public health will do nothing to repair the damage that has already been done by the misinformation being spread online, the platforms that have been given to those with dangerous views, or the conspiratorial accusations without proof that have been lobbed at our nation's public health officials. No, the way that we can move forward is by identifying common sense solutions that will save lives and reduce harm when the next pandemic arrives on our doorsteps. And so I just want to say, too, that my absence was due to votes and other unforeseen circumstances. I appreciate all of you for being here. And I also want to say I urge my colleagues to join me in working toward these forward-looking solutions, and I yield back.
I thank the ranking member, and I have no doubts that something took precedence, as I understand your devotion to this issue. And I've said it many times, to me, something that should have united our country became something that divided us terribly. It was a political year. It was a presidential year. This hearing today, however, was about the mandates, the consequences of the mandates, and going in that direction. I'm a soldier. When you're looking at solving problems, you have to look at the battlefield and understand it and know what's out there. And you can't ignore things that have created public distrust or whatever. I thought there was no greater example than a video that was released when Dr. Fauci was going door to door to try and get people vaccinated. And this young man stood on his porch, and he probably had socioeconomic conditions that might make him more vulnerable. And he flat out told him, no, leave. He wasn't convincing. It didn't do the job. I said from the very beginning, and I said this to both administrations, America needs to hear from the doctors treating COVID patients. And not just them. Because there's so many things that our policies did that we have to take a look at. You know, Dr. Lynch, you talked a lot about the vaccine, and that's what you were here to do today, and I understand that. But there are a lot of people who didn't go to the doctor, didn't get their cancer diagnosed. And I'll talk about those things in just a minute. But if we don't admit to failed ideas, we will never be better. And I listened to my friend in his opening statement, Dr. Ruiz, and he flat out said, I might have to check the record, that the vaccine prevents transmission. But then he went on to say, it lowers the chance of transmission. So how you say things matter. And, you know, we can say it's safe. Do we know 10 years from now what this vaccine's going to do? No. No. And frankly, I don't want to wait to deal with something like Agent Orange 30 years later. We need to look at this now. I don't know. I try to understand what really long COVID is. I keep hearing that definition. And I don't necessarily understand what that is. But I have a lot of people wondering, do I have a problem because I got COVID or because I got the vaccine? They don't know. And frankly, I don't think we know. So let's be honest about those types of things. And let the American public know that we're looking at everything, that it's not this way and only this way. You know, we talk about the doctor-patient relationship and how important that is. Every drug ad you see on TV, which I have problems with those, but every drug ad you see on TV says the side effects. Make sure you know them. As a matter of fact, you can't run that ad without telling every single side effect that's been reported. And then they say, talk to your doctor about this drug. We didn't do that. We didn't do that. People that lost jobs were harmed. You know, I agree with Ms. Dingell about childhood vaccines. We all do. There are 5 doctors here on this side of the aisle that are accused of trying to tell people not to get vaccines, and every single one of them has said that is not what we're saying, but what we haven't done as a country is explain the difference between this new technology, this new vaccine, and the other vaccines. Ms. Dingell had the benefit of seeing a doctor. She had the wherewithal. There's a doctor here for all of us to see in the House of Representatives. She can see a doctor at home. Not everyone has that wherewithal very easily, especially during a pandemic, and she had the conversation. And you know, believe me, I feel for her. That had to have been extremely, extremely disturbing to get Guillain-Barré. Fortunately, she recovered from it. But we can't just say, well, she had a side effect. We can talk about that, but we're not talking about other side effects that people are reporting. It's important. And Dr. Lynch, I don't disagree with you for 1 minute that more people, that our numbers got better with more people getting vaccinated. I don't disagree with you that at all. But it was mentioned today, the way we went about it, there was a short-term gain, but long-term harm. Very long-term harm. And we have to take a look at what we have done. I got vaccinated, Pfizer, both doses. 6 months later, I got COVID. The only reason I knew is I couldn't smell garlic salt. I was told I needed a booster to travel. I said, I'd like to check my T cells and antibodies. The lab here couldn't do the T cells. We got my antibodies. Strong number was 40. My number is 821. Should I get a booster? That's a legitimate question. I don't want a hyperimmune response. Dr. Fauci, you know, a lot of things are coming out, things he said previously. You see the video of him, 2004, and he's in an interview, and they said, so should people who have had the flu get the flu shot? He emphatically said, no, no, no. They got more immunity than anybody. They're protected. America sees that. How do you explain the difference here? We didn't discuss the differences between those other diseases, polio, measles, mumps, rubella, compared to COVID-19. Well, at first, we didn't know much about COVID-19. But as we knew things, I never saw one public service announcement explaining the difference between those vaccines and this vaccine, or those diseases and this disease. Not one. Not one. We didn't look at the psychological effects, the physical effects, the financial ruin that some people got for getting fired. We had non-infected people that then lost their health care, denied their medical care. They weren't infected, they weren't transmitting, but they were told to go home, you're fired, no benefits. Tell me that makes sense. How is that logical? I've said for a while, the vaccine is a big help, no doubt about it. But also, We knew from the trials that people that got vaccinated still got COVID. We also know that vaccines produce variants. I thought as a country we should have put greater emphasis going forward on treatments for this problem. I want to share with you a ruling in January of 22 by the Supreme Court. And Ms. Williams, I think this one's for you. The Supreme Court struck down a Biden administration mandate that large businesses require their employees to either be vaccinated or tested once a week for the coronavirus. In a 6-3 order, the justices blocked an occupational safety and health administration emergency rule for businesses with more than 100 employees, one that would have impacted more than 80 million workers. That's from the Supreme Court. Let me just say, I want to thank our witnesses today. I really appreciate you all being here. Helpful discussion. And your testifying today is impactful, and it does help guide us as we try to prepare for the future. But we did this hearing today not to demonize the COVID-19 vaccine, but to examine the federal government's mandate so that we can investigate the effectiveness of a policy that required Americans receive a novel vaccine, regardless of their health status, regardless of prior infection. That didn't make sense to a lot of people, and rightfully so. As we heard today, it was much more than a choice between a novel vaccine and a job. It became a choice between a vaccine and a livelihood, between a vaccine and a child, between military readiness, our very own national security, and political agendas. Agendas that I don't even understand why they were political. We heard today how a coercive approach to vaccines not only led to an increase in distrust in public officials, but also decrease in the likelihood of many from receiving the vaccine or other vaccines that they should be getting. We witnessed government officials vilify and ostracize those who did not accept their blanket approach to individual health concerns. And as we continue our after-action review of the COVID-19 pandemic, we must look at federal policies that were implemented and decide if they were effective, and whether we would recommend such policies in the future, and what the environment of the nation is at that time and how we go about our approach. Was stripping Americans of their individual freedoms, of their bodily autonomy, worth it? Did it help end the pandemic? Or did it create more lasting harm, as I referred to before, and divide Americans further? Did it force Americans who were not at serious risk for COVID instead take a vaccine that could potentially have adverse effects that they don't know? They don't know where they'll be in 5 years or 10 years. We have evidence that mandates made Americans even more suspicious of public health authorities and more became suspicious of other vaccines. I was all for the emergency use authorization. People were dying. And we started to realize pretty quickly what people were dying. We understood their health, their comorbidities, why they were more vulnerable, because of their age. We prioritized those that were at greatest risk, which we should have done. That was right. We were promised that the vaccine would stop transmission, only to find out that wasn't completely true, and America noticed. They noticed that. Because I said so is not a good enough reason for the government to mandate a vaccine for millions. The Select Subcommittee on the coronavirus pandemic has been charged with examining pandemic-era policies, including vaccine mandates, not to create more distrust, but so that public health might be worthy of the public's trust in the future. Only when we have gathered the facts can we make informed recommendations for the next pandemic and create a playbook to help protect Americans' health. And cutting your doctor out of the equation is not doing that. We've seen the effects and the divisions that stem from the mandates. You saw it right here on this panel. If we truly care about America's health and truly care about individual liberties, which our founders believed paramount to this great nation, we need to do better during the next pandemic. And maybe next time there'll be respect and information rather than indoctrination and demonization. We have a unique opportunity here as a part of this select subcommittee to learn from our public policy, our mistakes, so that better and more effective ones can be implemented in the future. This hearing is a significant step in doing that. The government shouldn't get away with "because I told you so." It's not the American way. Americans aren't built like that. They shouldn't mandate a novel vaccine at the expense of your livelihood or your future child. I want to thank you all for being here today. And I want to assure you, Dr. Lynch, we want to continue to work with the medical community to go forward for what's best for America, because this is going to happen again. And you know what? Next time it may affect children more than adults. We don't know. But I do want to tell Ms. Runyon and Ms. Williams that we are here for you to not only to protect your rights, but to protect your health. With that, without objection, all members will have 5 legislative days within which to submit materials and to submit additional written questions for the witnesses, which will be forwarded to the witnesses for their response. And if there's no further business, without objection, the select subcommittee stands adjourned.